8 medications have been linked by scientific studies to a heightened risk of dementia. Additionally, memory loss does not have to be an unavoidable part of aging. Recent findings indicate that we can maintain our brain health for much longer than we once believed, provided we understand how to care for them appropriately. This raises important questions. Why can medications that appear to be harmless lead to such significant harm? And how can we safeguard our brains while addressing other health issues? These are vital inquiries we will explore throughout this video. It's crucial to note that our intention is not to vilify modern medicine. Many of these drugs are vital for managing serious health problems and enhancing the quality of life for countless individuals. Nevertheless, it is important to be aware of the potential dangers and learn how to mitigate them. Now, let's begin our discussion with 2 medications that may seem innocuous, but can have severe long-term consequences: omeprazole and anticholinergics. Nergic medications. First, let's discuss omeprazole. This drug is among the most widely used for managing heartburn, acid reflux, and gastric ulcers. It is classified as a proton pump inhibitor, or PPI. It may seem harmless, but recent research has uncovered a troubling link between long-term use of omeprazole and a heightened risk of developing dementia. A study involving approximately 6,000 individuals indicated that 10% of those who used omeprazole for over 3 years experienced memory issues. Another investigation revealed that 33% of patients who took the medication for more than 4.5 years reported cognitive problems. So, how does omeprazole influence the brain? It is thought to hinder the absorption of vitamin B12, which is vital for maintaining neurological health. Furthermore, omeprazole may disrupt gut microbiota, which can negatively affect brain function. It is essential to emphasize that we are not advising you to abruptly discontinue omeprazole if you use it regularly. Please consult your doctor for guidance. Here's a revised version of the text translated into English with modified wording. Regarding alternatives, or the potential to decrease the dosage in numerous instances, changes in diet and lifestyle can assist in managing gastric issues without the necessity for ongoing medication. Now, let's discuss anticholinergic medications. This is a diverse category of drugs utilized to address various conditions, ranging from allergies to depression and urinary incontinence. The concern arises from their ability to inhibit the action of acetylcholine, a neurotransmitter that is vital for memory and learning. Research indicates that long-term usage of anticholinergics is linked to a notable increase in the risk of developing dementia. A study conducted by the University of Washington, which monitored over 3,500 elderly individuals for a decade, revealed that those who frequently used anticholinergics had a 54% elevated risk of developing dementia. Common examples of anticholinergic medications include first-generation antihistamines such as diphenhydramine, certain antidepressants like amitriptyline, and drugs for urinary incontinence such as oxybutynin. The indiscriminate use of these medications can be concerning. The use of these medications, particularly among older adults, raises significant concerns due to their potential to lead to cognitive decline. If you are currently prescribed any anticholinergic drugs, it is important not to discontinue them suddenly. Instead, consult your physician regarding safer alternatives or the possibility of lowering your dosage. It is essential for both patients and healthcare providers to thoroughly evaluate the risks and advantages of anticholinergic medications, seeking alternatives whenever feasible, and restricting usage to the minimum, to required levels and durations. The primary issue here is long-term use. Taking an antihistamine occasionally to alleviate allergy symptoms is unlikely to result in lasting problems, but ongoing use, especially at elevated doses, is what truly alarms researchers. Next, let's discuss 2 categories of medications that, while effective for various ailments, can pose significant risks to brain health: corticosteroids and benzodiazepines. We will begin with corticosteroids. These medications are widely used. Corticosteroids are employed to address a wide range of conditions, from asthma and allergies to autoimmune and inflammatory illnesses. They are highly effective at alleviating inflammation and curbing excessive immune responses. However, extended use of these medications, particularly when taken orally, can lead to several serious side effects, including a decline in mental and cognitive health. Research has indicated that corticosteroids may induce structural alterations in the brain, resulting in issues such as disorientation, confusion, depression, and anxiety. An epidemiological study conducted in the United Kingdom, which examined data from over 500,000 individuals, found that those who used corticosteroids for asthma over prolonged periods faced a considerably greater risk of developing dementia and other mental health conditions. Glucocorticoids such as prednisolone and dexamethasone raise particular concerns when used long-term, as they may disrupt brain function, potentially due to fluctuations in cortisol levels, a stress hormone. Hormones that are present in excess can harm neurons in the hippocampus, which is the area of the brain responsible for memory. If you are using corticosteroids, particularly over extended periods, it is essential that your usage is closely monitored by healthcare professionals. Do not cease taking corticosteroids abruptly, as this may pose serious risks. Instead, consult your physician about the possibility of gradually tapering off the dosage or considering alternative therapies. Now let's discuss benzodiazepines. These medications are commonly prescribed to address anxiety and insomnia, noted for their calming and soothing effects. Drugs such as alprazolam, diazepam, and lorazepam are effective for quickly alleviating symptoms of anxiety. However, long-term use can lead to significant repercussions for brain health. Research has shown a clear link between extended use of benzodiazepines and memory impairment. Studies suggest that these medications may double the likelihood of developing Alzheimer's disease, potentially due to irreversible brain damage. One study revealed that over 40% of users of benzodiazepines have reported experiencing various neurological symptoms. These symptoms include challenges with concentration, fatigue, anxiety, and heightened sensitivity to sensory stimuli, along with memory impairment. Extended use of benzodiazepines is linked to several other negative effects, such as sleep disturbances, anxiety, muscle pain, and weakness. Moreover, the risk of developing physical and emotional dependence is significant, which can make it difficult for numerous patients to discontinue these medications. The connection between benzodiazepines and Alzheimer's disease raises particular concerns. Although the precise mechanism remains unclear, it is thought that these medications may disrupt the normal functioning of neurotransmitters, resulting in both structural and functional alterations in the brain. Furthermore, long-term use can adversely impact the sleep cycle, which is vital for memory consolidation. If you are prescribed benzodiazepines, it is crucial that their usage is monitored closely and restricted. Consider non-pharmacological methods for managing anxiety and insomnia, such as cognitive behavioral therapy, relaxation strategies, and modifications to your lifestyle. When the use of benzodiazepines is deemed necessary, it should only be for brief durations and at the minimum effective doses. It's crucial to never discontinue benzodiazepines suddenly, as this can lead to severe withdrawal effects. Always consult your physician before altering your medication routine. Now let's discuss two categories of medications that might come as a surprise: amphetamines and first-generation antihistamines, as we continue our exploration of substances that can impact brain health. Starting with amphetamines, including the well-known Adderall, these medications are commonly prescribed for attention deficit hyperactivity disorder, often abbreviated as ADHD. They are recognized for their effectiveness in enhancing focus and diminishing hyperactivity in the short term. However, extended use of amphetamines can have significant consequences. Antidepressants can have negative effects, including issues with memory. Amphetamines function by boosting the levels of neurotransmitters such as dopamine and norepinephrine in the brain, which temporarily enhances concentration and focus. However, prolonged use can result in various complications, including physical and emotional dependence, sleep disturbances, irritability, and even depressive symptoms. Memory impairment is one of the most alarming side effects linked to extended use of these substances. Research indicates that high and extended doses of amphetamines may lead to irreversible brain damage, in addition to memory issues. Long-term users might notice a decline in motivation and overall cognitive abilities, with these effects potentially lingering even after the medication is stopped, suggesting enduring harm. Another major concern with amphetamines is the risk of misuse and addiction, given their stimulating properties. These substances can be abused, resulting in severe health issues such as irregular heartbeats, gastrointestinal problems, and in extreme cases, sudden death. Dependence on medication can pose a significant obstacle, making it challenging to discontinue use even when negative effects become apparent. If you or someone you are aware of is taking amphetamines for attention deficit hyperactivity disorder, ADHD, it is essential that their usage is closely monitored by healthcare professionals. Therapeutic alternatives and non-drug approaches, such as behavioral therapy and stress management techniques, should be explored for treating ADHD. Now, let's discuss first-generation antihistamines, like chlorpheniramine and diphenhydramine. These medications are commonly utilized to alleviate symptoms of allergies and colds. While they are effective in providing prompt relief from issues like nasal congestion and itching, they also have a downside. Their long-term use can lead to negative effects on memory and cognitive abilities. First-generation antihistamines function by inhibiting the action of histamine, a substance in the body responsible for allergic reactions. However, they also possess anticholinergic properties, which means they inhibit certain neurotransmitters. Acetylcholine is a neurotransmitter essential for memory and learning. Extended use of certain medications may therefore result in notable cognitive difficulties. Research indicates that first-generation antihistamines are linked to a heightened risk of dementia. A recent review of 138 studies concerning the adverse effects of these drugs revealed a strong connection between long-term use and cognitive impairments. Patients who frequently use these medications have reported experiencing memory issues and trouble concentrating, even after discontinuation. Fortunately, there are safer alternatives, such as second-generation antihistamines, for instance, loratadine and cetirizine. These medications tend to have fewer side effects and are not associated with cognitive complications. They are recommended for long-term allergy management, providing effective symptom relief without similar risks to brain health. In addition to cognitive risks, first-generation antihistamines can lead to other side effects, including drowsiness, dry mouth, and blurred vision. Effects can greatly influence an individual's quality of life, particularly among elderly individuals who are more vulnerable to the negative impacts of these medications. To mitigate potential risks, it is crucial for patients to consult their healthcare providers prior to using first-generation antihistamines for extended durations. Exploring safer alternatives and adopting additional strategies for managing allergies, such as making environmental and dietary adjustments, can aid in decreasing the reliance on these medications and safeguarding cognitive health. If you are taking any of these medications on a regular basis, do not discontinue them suddenly. Always seek advice from a healthcare professional before altering your medication plan. Now, we arrive at the final subject on our agenda, where we will delve into two classes of medications that might catch many off guard: tricyclic antidepressants and statins. Let's begin with tricyclic antidepressants. Drugs such as amitriptyline and nortriptyline were among the earliest developed for the treatment of depression. While these medications are effective in reducing symptoms of depression, they come with a side effect profile that includes memory impairment and various cognitive challenges. Tricyclic antidepressants function by inhibiting the reabsorption of neurotransmitters like serotonin and norepinephrine, thereby enhancing their presence in the brain. Nevertheless, they also possess significant anticholinergic properties, which means they obstruct acetylcholine, a neurotransmitter crucial for memory and learning. Extended use of tricyclic antidepressants has been linked to a heightened risk of dementia and other cognitive impairments. Research indicates